Hi everybody. I wanted to come on and do a video today to kind of discuss birth stories and my experience as a mom of 4, and then also my experience as a nurse hospital corpsman who has been on the inside of the medical system, assisted in labor and delivery, and so much more. I kind of wanted to go over experiences, what I've seen in the hospital versus home birth. I have had 2 hospital births and I've had 2 home births, and then we are pregnant with our 5th, hoping, God willing, for another safe home birth this fall. Kind of wanted to give a timeline of where I started in my birthing journey and as a medical professional, and how I've ended up here to a stay-at-home mom who does home births now. So I'm a nurse, RN. Prior to that, I did hospital corpsman in the Navy, where I worked labor and delivery and med surg for several years. And while I was in, I actually challenged the LVN board and became LVN licensed before I even left the military. When I got out, I did the LVN to RN program, and then I did the RN to BSN program. So I've been in the medical field since I was, well, even prior to that, I was a medical assistant out here. So I've been in the medical field, oh my gosh, about 20 years, give or take, maybe 18. This is not where I ever thought my life would be. So my first child was with my ex-husband, and we had a hard time conceiving for a plethora of reasons, which I won't go into on a public forum, but we ended up having to do IVF. That in itself was a whole different experience. At the time, I felt it was a good experience because we had been trying for quite a while and no conception. So finally, am able to have a child, and I am an RN at this point. So I feel a hospital birth is what I'm supposed to do. Nothing else is in my mind. There's just the one tunnel vision. You see the doctor, you do what you're told. I even had several instances myself where I felt like I had to kind of step out of the patient role and advocate for myself, but I still went down the role of patient, listening to doctor, not really questioning anything. I did have some complications with the first that I've learned since were actually because of the IVF, most likely. I did end up becoming preeclamptic pretty early on. But again, this is before I knew anything about diet, herbal supplements, actual true health for a person. So again, just following the normal medical model. I did end up having to be induced at 38 weeks, 38 and change, I think. I don't know. So this was in 2012, long time ago. They admit you, because I was symptomatic and so preeclamptic, I was at risk for seizures and everything because blood pressure was really high. I was on the lovely mag drip, and then they did the oral medication. I don't think they did Folibol, but they did Pitocin, of course. And I had gone into this thinking I want a natural birth. Well, as anyone who's had Pitocin knows, generally once you start receiving that kind of goes out the window unless you're like Xena Princess Warrior, because I was not having that. It was actually, there was no relief in between contractions with it. It was just absolutely awful. So I ended up getting the epidural. And mind you, this is a slow induction. It took about 2 days. It was my first, so it is anticipated to take a while. I tell my daughter that she got evicted early and she did not want to come out, which is completely true. So I did get the epidural. I was on the mag. Mag, if anyone's ever been on it, is absolutely awful. I felt like I had a knife in my head for at least the first 24 hours of being on it. And they put you on hydration restrictions, so I couldn't have fluid. I could have like a cup of ice chips, I think, like every hour. And the nurses did not want to be in there every hour. And being a nurse, I understand why, but that's still a part of, that's something I remember, was starving for ice. And then of course not eating because of hospital policy. And then when I had gotten there, because I had actually done my clinicals at this hospital, I was specific in that I did not want students. I did not want excess personnel in this experience. It was my first child. I'm a very private person when it comes to birth, which I'll get into later. So I still had a professor come in, actually tried to do my IV and didn't work. So that was already going against my wishes. And then the time came to what they said was my time was to push, but of course I have the epidural, I'm numb, I can't feel anything, it's my first child, don't even know what I'm waiting for, other than what I've seen in previous things for labor and delivery. But it's a difference between watching and assisting on the side as opposed to having your own child, which I'm sure people can understand. So when I'm told to start pushing, that's great. Hours later, the nurse went and gets an OB, or who I thought was an OB, but ends up coming in with two supposed doctors. And I'm now crowded in this room with lots of people. Now, mind you, there is some things that had to happen because I was on the MAG and having epidural. The NICU had been coming in and out. They were setting up and everything just in case, pediatric doctors and stuff, because for magnesium, it can kind of dull their respiratory reflexes. So that was fine. I understood that. But the time came and I had two people down there actively checking constantly. And when I told them to leave, I actually literally told one of them to get out, and they told me to shut up. They're there to help, which, yeah, no. And unfortunately, my ex just kind of said, okay, be quiet. So that was traumatic in itself for me because, again, bodily autonomy is very big for me. And even then I knew that that was not happening. But again, I'm at the mercy of these people delivering my child. I was exhausted, hours upon hours of this. So basically, I look over and there's a line of people along the wall, probably 4 or 5, a line of people along the wall watching me. Hands behind their backs, wallflowers. I ask who they are. I'm told they're students. Now, mind you, I specifically said no students. I already had a pediatric doctor. I had 2 people down there telling me to push. I had a nurse. And I had other people coming in and out. And then now there's this line of people that are students watching me. And I told them to get out. And I was told to shut up again. So, needless to say, that delivery did not go as well. There was a plethora of other issues. But just to kind of paint the picture of what started off as a great thing for me, having a child that we tried so hard to have, to basically just being this entity on a bed, and not being seen as a person, not being given any respect, dignity. That was a big thing for me. My daughter did come out okay. She did go to the NICU for a few hours just for watching her respirations and such. But everything was okay. Fast forward several years and pregnant with my next child, with my current husband. And I knew I didn't want that same scenario, and I had heard about doulas. So my husband and I had interviewed several doulas. We had hired a doula. Been working with a doula. And if anyone doesn't know what a doula is, they can help give you education on different policies and procedures that a hospital might have. They can help teach you how to advocate for yourself, and then they can also be there to help your partner, your husband, to know how to support you as well. And also, so doulas actually have a very high statistical factor of lowering the rate of C-sections because that they're there. It's just this deterrent between the staff and the mom. It's a beautiful thing. When we went to the hospital after my water broke, we weren't there very long at all. I had specifically said I don't want to be in bed. I had really bad back issues, which have continued on all these pregnancies. If I lay in bed, that's the worst thing for me. The sciatica nerve, it's awful. And I want to do this as natural as possible. I want to be up moving around. I consented to like an IV port, just a saline lock, just in case of emergencies, because I still have that medical mind and I've still seen all those emergency situations. So I don't want, and I'm a very difficult stick, so I was consenting to that. And then as for the monitoring, I wanted the wireless. So this is 5.5 years ago. So I wanted the wireless, which was a new thing back then, for that. But when you start stacking things up and monitoring so closely for a normal pregnancy, for nothing that actually has factors, you kind of can let in issues, perceived issues, things that are actually natural, but that the modern medical model will say that, for policy, we need to do this. So within, I think it was an hour or two of laboring pretty hard and quickly, my doula went out into the hallway to get some ice, and the nurses stopped her and said she needs to prepare for a C-section. And my doula was basically taken aghast, like, what are you talking about? No, I think it's a little early, and that's something you need to discuss with them. Because the thing with the doula is they don't actually make decisions for you, and they can't actually speak for you. So that's why they're working with you prior to the labor, to get you to learn what you want, learn how to speak that. They can say, okay, hold on, let's see what the parents have to say about this, or did you hear that? Did you want to say anything? Do you have any more questions? Speaking to me. And so it gives you that opportunity to kind of be like, and ask your questions, or say, hold on, that's not what I want. They kept pushing me in bed, saying they had to check, they had to do this, they had to do that. A thing that I've learned since then is checks, cervixes are not crystal balls. What it really does is turning on the lights can stop labor. All these constant changes can stop labor. For me personally, it was my back, getting on my back. They started saying decels, issues, need to get in bed, need to hook you up to fluids, lots and lots of fluids. And basically, by the time I was in transition, I gave up. I said, I want the epidural. My back is just on fire. I can't move. And that was because of the sciatica and being pushed into bed. I wasn't able to move. I wasn't able to listen to my body and do what I needed to do. When you're on your back, you have your tailbone. So that is not that is a modern position. That is not a normal, natural position, to be on your back with your knees up, pushing. That's harder for mom. It's harder for baby to get up and over that tailbone. Gravity is not working for you. And we are always told our entire pregnancy not to lay on our back because of the blood. It can restrict the blood flow. The other thing that they don't really tell you, it's in your paperwork that you sign, but they don't really go over it with you, in my experience, even in the Navy and while I've gotten 2 epidurals, is that the medication being used can significantly affect not just yourself, but your unborn child, because it does cross the placenta and can cause respiratory distress or anything else, really. It's a drug. It's a hard, heavy drug. I did consent to the epidural. I was on my back. Again, they're like, decels, and they used a vacuum, which traumatized my poor husband. Oh my gosh, he thought that that the baby's head was going to pop off, and that has stuck with him for so long. But it caused me to tear. It left a ginormous hematoma on my son's head. It's still there. They tried saying that, don't worry, his head is malleable, he'll grow into it, the bones will shift and mold. It really hasn't. It's just not noticeable now with his hair. It was so bad we actually had to have an ultrasound to make sure there was no active bleeding in the brain and surrounding tissues. And this was, again, it was all manufactured because of the medical model, and I'll go into why we firmly believe that in a second. And then being in the hospital again for several days for still a vaginal birth. My poor husband slept on a windowsill, if you would even considering that sleeping. Being woken up every 30 minutes, that's not healing. That's not healing. Moms and babies need to connect. We need to nurse. We need to feel safe. We need to rest. Mom and baby have gone through a lot in that time period. So when I got pregnant with my third, I just kind of asked my husband, I said, hey, how do you feel about a home birth? And he was like, great, sounds good, let's go. Interviewed some midwives, started reading different types of books, because before I'd read, like what to expect when you're expecting. I'd gone on things like Baby Center. I'd read my old pediatric books, OBGYN books from nursing school. I did all the medical journals, that kind of stuff. So I did a complete switch, and I'm going to show you the books that I did read for my third pregnancy that kind of helped. These were all recommendations from my doula, who I did use again for subsequent deliveries. So the Natural Pregnancy book, I can put a link below. This is a great book, your complete guide to a safe organic pregnancy and childbirth with herbs, nutrition, and other holistic choices. And it does actually, I believe this one does go into the history of birth and why women are routinely told to lay on their backs now. I'm not going to say it on here because it's quite disturbing to me. Another one that I did read partially, I kind of flipped through it and saw things that were interesting to me because it's not totally my forte, but Birthing from Within was very helpful. So those are some of the books. I have other ones that I'll show later. My third and subsequent labors and births were they were drastically changed with a different medical model being used with true midwifery. And I thank God every day that I feel that he put that in my head that one day that I just out of the blue, asked my husband, hey, let's do a home birth. I feel that was God's direction, and I am very thankful for it. With these subsequent home births, not only did my midwife come to me in my house, not every midwife does this. My current midwife for my fifth does not, but my third and fourth, she would come to the house. She got to know me and the family. My husband would be there. The other kids would be there. They get to see, different things. I didn't have to pack them up, take them to a sterile environment, get a 15-minute chit chat about nothing with a doctor or even a midwife there at a clinic. But she would spend probably an hour each time with me and my family. She'd do the Doppler if I wanted. Once we were far enough along, she would ask what I wanted. She would do any kind of labs. She'd order anything that I wanted to do, but she wasn't actually demanding of it. She wasn't saying, okay, this is what you do at this time. She would say, okay, this is normally when we do this. Do you have any questions? Do you want to go through it? Do you want some literature on it? And then I could go from there. It was very nice having an open dialogue with somebody along those lines. It made me feel a lot more respected as a person, as a mother. With her knowing the kids, when the big day came the first time, it was, things as normal. It was nice. One thing I should mention is my first child was 7 pounds, 11 ounces because she was early. My second child, and I fully believe it was because of the fluids that I was given, was 10 pounds, 2 ounces. Now, you guys might think that's a lot. Just hold on. So those were my most difficult births, labors and births. They were excruciating, awful in so many ways. And I had the most complications with my second one when they used the vacuum. So for my third, that was a concern because he was a big baby. My third was actually almost 12 pounds. At home, no complications, none. 3 pushes, he was out. My midwife said it was like a cinder block. Normally you kind of do this to come out. No, he just barreled right on through. Take that as you will. It was still so much easier. He was 11 pounds, 14 ounces, and he was like 40 weeks and a couple days, I think 2 days. It was a very fast labor, a precipitous labor. We call him our little monkey baby because he was so big. He was like squished, and like his forehead came down to his eyes. He was just so big. And my midwife looked at his umbilical cord and said it was like a garden hose. So he was thriving. And the fact that I could do that at home with no complications and just a relaxed environment was amazing. It was absolutely amazing. He was born in a pool in my bedroom. My doula was there along with my midwife. Both of them just kind of stayed back like I wanted. It was my husband who was there with me, giving me the support. My doula would go around and just make sure that he was eating and drinking and offering me stuff. And then that's what I need. I need to be left alone. I need to just kind of concentrate, breathe. She would remind me to breathe too. Kind of relax your shoulders, just kind of the things that we had practiced. She was able to do that a lot better. We had the lights down. My parents were over with the kids, so the kids were just in the living room and living space. They were able to come in right after if they wanted, which they did. They wanted to come see the baby. And my parents were able to come see the baby, and we were able to sleep in our own bed. We were able just to relax. Family was able to come over as we allowed. It was so much calmer, and I really wish that more people talked about home birth, which is kind of why I'm doing this video. Is I really want people to understand that there are options, even if you don't want to do a home birth. The hospital is really supposed to be designated for sick people or people that have a high risk pregnancy. And no, age is not a reason for high risk. Large babies are not a reason for high risk. Those are manufactured within the current medical model, and it lets them bill higher cost to your insurance. So for my fourth one, we were obviously doing a home birth. Same midwife, same doula. It was easy breezy lemon squeezy because, again, you know everybody. You're doing it at home. We had most of the supplies already. We had the labor pool. Just needed a few things. Everybody knew the drill. No issues. By then, I had learned a lot more about nutrition, about what to expect. And my fourth one came out 11 pounds, 12 ounces. Absolutely no issues. That one was a fierce birth, I will say that, because I decided to do castor oil because I was uncomfortable. I don't recommend it, especially on your birthday. She was born on my birthday. We share a birthday. So yeah, I think that was like a 3-4 hour labor, but 11 pounds, 12 ounces for my fourth and no complications. Got to stay home, got to rest, everything again. It's beautiful. Highly recommend. For this one, we have moved, hence the reason for now we have a new midwife, or I would gladly still be using my other one. So for this one, hopefully it will be the same, God willing. I am doing a lot of different things this time around as far as what I'm eating, what I'm doing. I'm no longer working nights in a hospital as a nurse. I am now a stay-at-home mom, have different responsibilities. I'm not fluctuating my sleep cycle. I'm not eating bad food from like the cafeteria, vending machines. I'm actually eating from scratch, cooking lots of stuff from our garden right now since it's summertime, eating from local farms, that kind of thing. Not really, no chips, no Skittles, things like that most nurses like to snack on at night. It's been probably one of the easiest pregnancies so far. Granted, I'll be 28 weeks tomorrow. I start third trimester tomorrow. So anything can change for me. Obviously, I still have a little bit to go, 3 months. I'm feeling much better, and I'm older. I'm 39. So go figure. The pregnancy when I was 27 versus the pregnancy when I'm 39, I feel better now than I did then because of the nutritional changes that I've made, the lifestyle changes that I've made, I should say, in every aspect, which I can talk about in a later video if you're interested. So some of the other books that I have since read, not necessarily when I've been pregnant, but when I've been wanting more information to help others. One thing that I did read with my second child was the Vaccine Friendly Plan, written by a pediatrician out of Oregon several years ago. I think a lot has actually changed since he wrote this. 2016 he wrote this, Dr. Paul Thomas. There's actually a lot of different options in here that he's given. Like for one, this is where I learned to take turmeric powder, take a spoonful, put it in water, and pray to Jesus as you drink that nastiness down and have a little chaser. It's the only time you can have a little chaser while you're pregnant. For headaches, the current medical model still recommends Tylenol, which is highly, highly, highly dangerous and should never be taken while you're pregnant, let alone when you're not pregnant. We'll go into that later. In the natural pregnancy book, it does go through different herbal remedies and such, and that was one of the gateways for me in learning herbalism. I'm still a novice, I feel like, but I could definitely use it. And then because all 4 of my kids have had tongue and lip ties, which I didn't find out till the second one, I highly recommend everybody reads The Womanly Art of Breastfeeding, the La Leche League, kind of understand what's normal, what's not, where to find help, etc. And just remember that you don't have to take one professional's opinion to heart. With my second, it took 4 different professionals, including 2 pediatricians and 2 lactation consultants, to find that he had the posterior tongue tie. Everyone kept saying he was fine. I'm like, no, I've breastfed before for 19 months and there were no issues. This hurts. This is not right. People kept calling me crazy. They kept saying that his blood sugar was dropping because he was such a big baby. He was only 10.2. And I say only because of my other ones. Anyways, it was because of his posterior, and they've all had posteriors, which is, I've learned, very hard to diagnose by lay people, including pediatricians. If that is you, if you're having issues and you keep being told that it's fine, there's no anterior tie, posterior is probably what it is. And I would highly recommend you find a pediatric dentist who specializes in tongue and lip ties, or a wonderful lactation consultant that does the same, that actually will know what a posterior is. So some of the things that I saw in the hospital as a corpsman, I look back on now and I'm aghast at the practices. I'm aghast at how I perceived things, and I'm ashamed of it pretty much. I wish that I would have done better personally. I wish I would have known better. Obviously, that was not necessarily my fault. I've gone down this road and I've learned a lot of things, and I'm hoping that I can help others make better decisions for themselves if they feel that it's needed. Most people that I've talked to, lots of moms over the years, didn't really want to speak up and say that they had bad hospital births because it was just the norm. It was what was needed. But what you're not realizing at the time is that it was created, it was manufactured, most likely. Again, this is not for the people that actually have high-risk pregnancies. Like my first was a high-risk pregnancy. It was a preeclamptic. I had battled for weeks. They actually didn't believe me. I would take my own blood pressure. It would be awful. I was seeing spots, but my urine dip was fine. That was the only diagnostic tool that they wanted to go by. But 170 over 100 for a blood pressure for 3 months is okay. I digress. But anyways, you don't realize that it can be, a problem is pretty manufactured. Like I had explained with laying on your back, you can have decels because now you're the blood flow, the epidurals, the lights. There's so much that can be manufactured, problems created. And then they go to the C-section, which is not something to be taken lightly. That is major abdominal surgery. It is not just a slice here and the baby comes out. It is going through your abdominal wall. It is breaking tissue. It is breaking muscle. It is not something that the average American woman these days, because let's face it, most of us don't eat and work out that great anymore, like we should. It's not the best way to start with your child. You're going to be healing drastically. You're going to have issues most likely later on with scar tissue and so forth. And if you don't, that's great. That's amazing. That's not the norm that I've found personally. But it is major abdominal surgery. I've been in on them many, many times in the Navy. And I would like to think that they were doing them the same as everywhere else. But when they're opening you up and your body shakes from being pulled apart, that's something that sticks with you. If you feel, or if you do truly need to have a hospital birth, I highly, highly recommend that you have at least a doula with you. But if you can, if you are having a normal pregnancy, and again, normal means you don't have any of those you're not gestational diabetic, or at least in California. I know Nevada is like the Wild West. You could be having twins and whatever, and you can still home birth. But in California, you can't have twins, you can't be breech, and you can't be gestational diabetic, you can't have preeclampsia, which that I understand. Age, stuff like that, weight even, is not a factor. So if you're even considering it, even if you've had a C-section before and you want to do what they call a VBAC, contact a local midwife, make that consult, tell them your history, tell them what you're wanting, and have a chat. Most consults that I'm aware of are free. It just takes a little bit of your time. Or at least understand what you're walking into in the hospital. This is becoming a lot more dreary than I meant to be. I really just want people to kind of stop and think about what they want, think about what they're willing to do, and think about the history of birth. I think it's The Beauty of Being Born or something like that, a documentary on Amazon. It's not free, you'd have to buy it, but it does go into why hospital is now like the number one stop shop for births. I think it was in the 40s, 50s, they had made like advertisements about having your baby in the hospital as a vacation, like pack your bag, bring your makeup, let's do this. And it's kind of, the pendulum swung all the way over there. It's starting to come back more. I mean, if myself, a nurse who never had that on the horizon, as can do it and then be an advocate for home birth, I'm hoping that it's going to come more centered. The pendulum. Birth centers are good. It's a good middle if that makes you more comfortable. So basically, if you're a woman of childbearing age, if you have had a child, if you're thinking about having children, if you are pregnant right now, I just encourage you to do your homework. I encourage you to look into the birthing history of America specifically, and even into England. And I highly encourage you to look at like the statistics of C-section rate, and especially at the hospitals in your area. Don't just go by the national, go by in your area. Because I think nationally it's like 30 something percent, but in my area where I was living, it was actually the hospital that I was delivering at was, I believe, over 50%. It was shocking. That's the percentage that would end in C-section. And it should not be like that. It really should not be like that. Birth is a normal, natural thing. So do your homework, make your decision, and know that you can switch at any time. If you start off with your OB, you start off with a hospital midwife, and you're like, man, these 15-minute appointments, if that, are just sterile and not what I'm wanting, you can always contact a midwife. I think for my third, I actually did congruent care. Yeah, I saw my OB, and I also had my midwife, because I was just so unsure of how it was going to go, and I wanted to be prepared. Needless to say, when I had my baby at home, that was 11/14, and the OB office called asking why I hadn't been in if I'd had my baby. They kind of when I told them, and they just couldn't believe me. But yes, 11/14 at home for my third, 11/12 for my fourth. Again, no complications, none. No gestational diabetes, no ripping, tearing, nothing, just peace afterwards. It can be done. It can be done naturally, and it can be done. You just have to find what works for you. I really hope that this actually helps some women learn what will be best for them, and make you kind of reevaluate that tunnel vision, if that's what you have, like I did for my first and basically kind of for my second. There are options. There are some states, I believe Georgia doesn't allow home births, so that is a different thing. Do your research in your state. Do your research for what you want as a mother, with your partner what you're comfortable with, know the side effects, go to different websites, go to your state regulations, go to mom forums and ask who they've used, go to evidence-based birthing, I think it's something like that, .org. And you can read a bunch of statistical factors on things like GBS, things on IV fluids, just everything. They have a lot of stuff there. I'll see if I can put the link in the description for you. Read books. I mean, if you want more than just this, I have plenty more. Same with these. These are all great books. If there's more stuff you guys want to know, just let me know in the comments. I'll be happy to answer it. If it's really lengthy, then I'll just do another video on it. But I really hope that women can start feeling empowered again. It is a beautiful thing that we are able to do. And my hope is that more women feel the empowerment as they are giving birth, and that they are not feeling stripped of that empowerment as they are giving birth. You deserve respect and dignity, even if you have predispositions and you have a high-risk pregnancy, you still deserve that. There's still different ways to get it. But just being respected as a woman, not just as an entity in a bed delivering another entity. I hope we can get the empowerment back. I feel God wants us to feel we should be proud of being women and proud of our capabilities. Hope this was helpful. Let me know what you think. And if you have any questions, let me know. See you next time.